What does it really mean to be healthy? It's a question we often ask, but the answer goes far beyond simply not feeling sick or avoiding the doctor's office. Health is more than just the absence of illness. It's about thriving in your daily life, feeling good in your body, and having the energy to do the things you love. The World Health Organization defines health as a state of complete physical, mental, and social well-being, not just the absence of disease or infirmity. This definition reminds us that health is a dynamic, ongoing process. This means health is a balance. Your body, your mind, and your social connections all matter. When these areas are in harmony, you're more likely to feel truly well. Physical health is what most people think of first, being free from pain, having energy, and being able to do daily activities. It's about taking care of your body through exercise, nutrition, and regular checkups, including dental visits. But mental health is just as important. It's about feeling content, coping with stress, and having a sense of purpose. Good mental health helps you handle life's challenges and enjoy meaningful moments. Poor mental health can impact your body, like neglecting oral hygiene when you're depressed. Stress and anxiety can even affect your immune system and your motivation to care for yourself. Social well-being is the third pillar. It's about relationships, feeling valued, and being part of a community. Supportive connections can boost your mood and help you stay healthy. Isolation can harm your health as much as a poor diet. Loneliness can increase your risk for illness and make it harder to recover. Even a simple dental problem can affect your social life. If you're self-conscious about your smile, you might avoid friends and gatherings, missing out on joyful experiences. All three aspects, physical, mental, and social, are deeply connected. When you nurture one, you often support the others as well. True health is a balance of these elements. It's about feeling good, functioning well, and connecting with others. A healthy body supports a healthy mind, and strong social ties help both. When you care for all aspects of your well-being, you build a foundation for a happier, healthier life. If one area suffers, your overall well-being is at risk. That's why it's important to pay attention to every part of your health, not just one. That's why health is a holistic concept, not just the absence of disease. When you nurture your body, mind, and relationships, you're truly on the path to lasting wellness. Illness isn't just a medical term, it's a deeply personal experience that goes far beyond what any test or scan can show. It's your unique sense of feeling unwell, which can show up in so many ways. You might feel tired, anxious, or simply not yourself, or have a nagging pain that just won't go away, even if every medical test comes back normal and nothing seems wrong on paper. Illness is subjective. It's about how symptoms affect your daily life, your mood, and your relationships with others. You can feel ill even without a diagnosable disease. For example, stress, burnout, or exhaustion can make you feel terrible, even if doctors find nothing physically wrong. These feelings are real and deserve attention. In dentistry, a patient might say, "My mouth just doesn't feel right," even if exams and x-rays are completely normal. Ignoring these feelings is a mistake. Healthcare is about understanding the whole person, not just the symptoms or test results. Illness is shaped by your culture, your past experiences, and the support system you have around you. Two people can react very differently to the same discomfort. One might panic and worry, while another might brush it off or ignore it. Illness is the combination of physical sensation and emotional response, shaped by your thoughts and feelings. It's the human side of health, the part that can't always be measured, but is always felt. Recognizing this helps healthcare providers offer better, more compassionate care and truly connect with their patients. Your experience matters, even if it can't be measured or explained by science alone. It's a vital part of your health journey. Disease is different from illness. These two terms are often used interchangeably, but they actually mean different things in medicine. Disease refers to the objective medical problem a professional can diagnose, often through tests, exams, or visible signs. It's a specific condition, like tooth decay or gum disease, that impairs normal function and can be identified by a dentist or doctor. For example, a toothache, which is the illness or what you feel, might be caused by dental caries. The disease, which shows up on an X-ray. You can have a disease without feeling ill at all, like early gum disease or high blood pressure, which often have no symptoms until they become serious. That's why regular checkups are so important. They help catch disease before it causes pain or other noticeable problems. Disease gives us a scientific framework to understand, treat, and prevent health problems, allowing professionals to make informed decisions. In dentistry, knowing the cause of tooth decay or gum disease helps prevent future issues, not just treat pain, but stop it from happening again. Modern medicine relies on identifying disease to guide effective treatment, using technology and expertise to find problems early. But treating disease alone isn't enough. It's just one part of the picture. The best care addresses both the medical problem and the person's experience, recognizing that how you feel matters too. That's how we move from just managing symptoms to truly improving health, by caring for both the disease and the individual. Oral health reflects the well-being of entire communities, not just individuals. High rates of dental disease often point to deeper issues, like limited access to healthy food or dental care. In food deserts, people rely on sugary, processed foods, leading to more tooth decay. The resulting pain and embarrassment affect school, work, and social life. Poor oral health is linked to other diseases, like heart disease and diabetes. Public health efforts must address both the disease and the personal barriers people face, like fear, cost, or lack of awareness. Understanding both illness and disease helps create better, more effective community health programs. Two main diseases cause most oral health problems: dental caries, tooth decay, and periodontal disease, gum disease. Both are widespread but largely preventable. Tooth decay starts when bacteria feed on sugar, producing acid that erodes enamel and creates cavities. Left untreated, decay leads to pain, infection, and tooth loss. Gum disease begins as gingivitis, red swollen gums that bleed easily. If ignored, it progresses to periodontitis, destroying bone and ligaments, causing teeth to loosen or fall out. These diseases cause pain, shame, and social withdrawal. People may avoid healthy foods or social situations, impacting nutrition and confidence. Chronic dental pain can even lead to anxiety and depression. Oral diseases affect more than just teeth. They impact quality of life. Prevention and early treatment are key to stopping this cycle. Two people can have the same disease but very different experiences of illness. Take Sarah and Tom, both diagnosed with moderate periodontitis. Sarah, a public speaker, feels anxious and self-conscious, fearing her career will suffer. Tom, a retired worker, isn't bothered. He sees it as part of aging and just wants practical advice. Their disease is the same, but their illness, their personal experience, is completely different. Good healthcare means recognizing these differences. For Sarah, support and reassurance are as important as treatment. For Tom, clear instructions and education matter most. Treating the disease is only half the job. Addressing the person's unique experience is what makes care effective. Compassionate care treats the whole person, not just the diagnosis. Every patient's journey is personal. Community dentists do more than fix teeth. They're public health advocates and educators. Their main goal is prevention, stopping disease before it starts. They teach kids and adults about oral health, run awareness campaigns, and make information accessible. Clinical prevention includes fluoride treatments, sealants, and early screenings for problems like gum disease or oral cancer. By catching issues early, they save people pain and reduce healthcare costs. Community dentists bridge the gap between health, illness, and disease. They prevent disease, treat it, and support people through their personal experiences. Their work helps build healthier, happier communities, one smile at a time.